When I first started here, working with Dr. Moertel and my previous mentor, we started a phase 1 trial using a tumor lysate. And being a big immunologist, we decided to follow the immune responses. And we actually saw some success. We saw in about 50% of the patients, we're talking the tumor lysate vaccine, there was a significant immune response, and survival actually was extended. And in one of the cases, we did see a glioblastoma disappear. Unfortunately, it reoccurred. So it worked to a sense, but it didn't work well enough. And that's when I started looking into the cerebrospinal fluid of tumor versus non-tumor animals and actually discovered the CD200 protein, which is used to shut off the immune system.
We saw that as these patients, either in the patients who didn't respond well to our therapy to begin with, their CD200 levels were very high. Those whose tumors came back later, we watched their CD200 levels go up as their tumors were fighting their way back.
Correct.
And so our whole point now is if we can wipe out CD200, we'll give our vaccine a greater advantage to pummel these tumors and keep them down.
CNS tumors have been announced this year by the American Brain Tumor Association that it is the #1 cause of mortality in children that's cancer related. The problem with CNS tumors is the checkpoint inhibitors are being used are antibody-based, and antibodies do not cross into the central nervous system. So we decided to target this immune checkpoint with what we call a peptide inhibitor. Hopefully, the fact that we're actually going intradermal instead of systemic is we won't induce toxicity, which we're seeing with a lot of immunotherapy.
Very frequently, the therapies can be quite harmful. Radiation to a growing brain can be devastating. Chemotherapy can have very difficult side effects. And then finally, we need to remember that radiation can cause cancer. And so giving radiation therapy, you're frequently curing cancer only to create another tumor later on. And the University of Minnesota has really led the way in teaching the world about late effects of radiation therapy and chemotherapy.
So we think we can actually expand our model into many solid tumors. We think that it'll be actually a rock star to some peripheral tumors, including melanoma and hopefully prostate and ovarian cancers and breast cancers as well.
And every once in a while, in the field of cancer therapy, these huge steps happen that make a big difference for a lot of people, and we really think this has the promise to do that. We've been doing this work for a long, long time now. CCRF, Dawn of a Dream, have been part of this work for, at least 15 years.
The hardest parts, probably, truthfully, raising money to do the work.
My hardest part was going to the clinic and seeing kids who didn't have an answer. I don't want what I've seen to keep happening to other children in the future.
That's why we work so hard to get this as quick as possible.
That's the focus.
That's the focus.